In terms of the financing of the reset framework, what role do you think industry or governments can play in this?
Well, I think what is very interesting to consider is how when you work out how you actually implement public health programs, usually you think immediately about how much does government need at the local level, at the state level, at the national level, international level, and you do your sums and do it. What makes tobacco harm reduction a real win for the governments at every level is that the major costs are borne by the manufacturers and the private sector. The cost of innovation have already been borne, billions of dollars by companies around the world. The costs of testing different products, of getting them out, going through the complex regulatory regime. And then most importantly, once they're in the market, who bears the cost of distribution and the supply chain and getting it into the hands of consumers, which is in the end what really matters. You want to make sure that every single smoker, every single user of smokeless tobacco products which are toxic has the opportunity to get a product that's safe and that is affordable. That's what the private sector does particularly well. So the full costs are no longer carried by the government, but are carried by the private sector, a big saving to the private budget, which allows them to use minimal amount to do what they do best, oversee whether there are any untoward effects, ensuring that there's a reasonable regulatory regime, and ensuring that the tax structure that works the way it does.